When couples reach the point in their lives when they are ready to have children, they talk about names, they think about the nursery, and they may even imagine their children taking their first steps. What they often don't consider is the possibility that conceiving may be harder than expected. Fortunately, there are many options for couples who are dealing with infertility. The first step is to identify the cause, and we can help. We offer compassionate and personalized care for couples coping with infertility and recurrent miscarriage. Our services include infertility testing, intrauterine insemination, laparoscopic surgery, and ovulation induction. Infertility for women under the age of 35 is considered a full year of trying to conceive without success. For women over the age of 35, infertility is defined as 6 months of attempting to conceive without success. The first step towards achieving your goal of pregnancy is to schedule an appointment with your gynecologist to discuss your health, your partner's health, as well as undergo a pelvic exam. At this time, your gynecologist will likely discuss several basic tests that assess fertility function for both you and your partner. These tests include blood work to assess for ovarian function, basal body temperature charting, semen analysis, and hysterosalpingogram. Basic blood work to assess your ovarian function includes cycle day 3 labs. Follicle-stimulating hormone, estradiol, and luteinizing hormone levels are checked day 3 of your cycle, with day 1 being the first day you start your period. Thyroid-stimulating hormone, prolactin, anti-Mullerian hormone levels, and a rubella titer are also frequently tested. These labs can all be done through our laboratory at Coastal Women's Healthcare and do not require an appointment for blood work. Knowledge of whether and when ovulation occurs is essential to fertility. Identifying the time when ovulation is likely to occur allows for proper planning of intercourse or intrauterine insemination when fertility is optimal. A simple method of estimating the time of ovulation is charting daily oral temperatures. A woman's temperature is lower during the first part of her menstrual cycle than it is during the last 2 weeks. The shift in temperature occurs near ovulation. Ovulation is assumed to occur when there is a rise of 0.4 to 0.6 degrees Fahrenheit or more between 24-hour readings. Use a metabolic thermometer or a digital thermometer with a Fahrenheit scale to check your temperature each morning. Your temperature should be taken each morning immediately after waking, before getting out of bed, eating, drinking, smoking, or undertaking any type of physical activity. Your temperature should be taken for 5 minutes by the clock if you are using a metabolic thermometer. You should start charting your temperature day 3 of your cycle, with day 1 being the first day that you start your period. Please make notes on your chart regarding any illness, additional medications, or unusual symptoms that occur that month. Your nurse can provide you with blank charts for tracking, or there are also websites or smartphone applications that allow you to track your temperatures. A hysterosalpingogram is an X-ray of your uterus and fallopian tubes, where dye is used to assess for any structural abnormalities. This procedure is done days 7 through 12 of your cycle at Maine Medical Center X-ray Department at the Bramhall campus in the early morning. If your provider has recommended this test for you, you will need to call the office day 1 of your cycle, the first day you start your period, to schedule. During the procedure, you can experience some cramping, so we recommend that you take 600 to 800 milligrams of ibuprofen the night before the procedure and the morning of. Your provider will be able to discuss the results of this test with you at the time that it is performed. Because fertility issues can be of female and male origin, often your provider will recommend a semen analysis for your partner. A semen analysis looks at the following: sperm count, motility, the velocity or forward progression of the sperm, the size and the shape of the sperm, total semen volume, and the liquefaction of the semen. A semen analysis does require an appointment with the lab, and your partner will need to create an account in our office with their demographic and insurance information prior to their appointment. The semen sample is to be obtained after 48 hours of abstaining from ejaculation and must be collected in a sterile cup that can be obtained from our office. The instructions for collection and transportation are very detailed, and a copy of these instructions can be obtained from a nurse in the office. A copy of these instructions can also be found on our website under the Patient Forms and Instructions tab on the fertility section. Depending on the results of the fertility testing for you and your partner, your provider may recommend intrauterine insemination, also known as IUI. IUI involves preparing specimen to separate the sperm from the fluid and placing these washed cells inside the uterus using a sterile technique. To be successful, IUI must be carefully timed to coincide with ovulation, indicated by a woman's monthly increase in luteinizing hormone coming from the pituitary gland and then appearing in the urine. The increase in LH can be tested through LH surge kits, also known as ovulation predictor kits or OPKs. These tests can be purchased at any pharmacy. Follow the instructions on the package, checking your urine daily, beginning about 3 days before your expected ovulation. For a woman with a 28-day cycle, ovulation typically occurs around day 14. We recommend testing mid-morning around 10 a.m., not using the first urine of the morning, and using digital tests which allow for easier interpretation of the results. When you have a positive result, call our office by 12 noon that day to schedule your IUI for the following day. If a holiday is on or near the day that you may need to be inseminated, please call us a few days in advance to discuss our schedule. If you are using your partner's semen for IUI, the sample can either be collected at home if you live within 1 hour of the office, or here in a room designated for collection in our lab. You and your partner will need to complete the semen collection form, which can be found on our website under the fertility section. Please make sure to check in at the front desk on arrival to the office. A government-issued photo ID or driver's license will be checked upon arrival at the lab. The preparation of the sample takes at least 1.5 hours. The specimen will be stored in an incubator at an ideal temperature for semen until the partner is ready to be inseminated. The appointment for the IUI will be booked 1.5 hours after the drop-off of the specimen and can be scheduled as late as 6 hours after the drop-off. At the time of your appointment for the IUI, your provider will place a speculum in the vagina and pass a small sterile tube through your cervix and into your uterus. The sperm solution is passed through this tube. The whole process should take only a few minutes, and you will be instructed to lie on the exam table for 10 to 15 minutes after the IUI is complete. If you do not have a period within 17 days of the IUI, please take a pregnancy test. Complications from an IUI are rare and include the following: cramping in about 5% of women, minimal spotting in 1% of women, mild nausea in 0.5% of women, and possible infection of the uterus and/or fallopian tubes in 0.2% of women. Inseminations are offered Monday through Friday in our office at a charge of $258 for the procedure and $150 for the semen preparation. You will be asked to come in for the IUI between the hours of 10 a.m. and 3 p.m. Saturday IUIs are offered through Boston IVF, who Coastal has had a close working relationship with for many years. Boston IVF is located less than 1 mile from our office, northbound on Route 1 at 778 Main Street, Suite 2 in South Portland. If you are to be inseminated at Boston IVF, they request a copy of your last visit and demographic information. Boston IVF will contact you directly with instructions and an appointment time. A government-issued photo ID or driver's license will be required upon check-in. Boston IVF is accommodating you by providing a physician and/or nurse, so please be aware that your appointment on Saturday is not subject to change after 12 noon on Friday. Pricing through Boston IVF may vary and payment is expected at the time of service. The treatment for infertility is not always covered by your insurance policy. We ask that you contact your insurance company to verify whether you have coverage. Payment is due at the time of service if these services are not covered by your insurance. There may be pre-certification or notification needed in order to have coverage. It is your responsibility to notify our office before the appointment if pre-certification is needed. Procedure codes can be found in the patient forms and information section under the fertility section of our website. If after several cycles you have not conceived, please make an appointment with your provider to discuss your plan of care.